So, according to the Government of Canada's website, the number of COVID 19 cases in Canada totals 9,017 as of April 1st, 2020. Here's the breakdown by province. So, you see, Quebec has the highest number of COVID 19 cases right now. This thing doesn't seem to want to focus. But, anyways, Quebec has 4,162 COVID 19 cases. Ontario is 2,392. BC is 1,013. Alberta is 754. Saskatchewan's 184. Manitoba is 103. New Brunswick is 70. Nova Scotia is 147. Prince Edward Island's 21 cases. Newfoundland and Labrador is 152 cases. Yukon Territory has 5. Northwest Territories has 1. Nunavut has 0. And there's 13 repatriated travelers. So that's a total of 9,017 cases of COVID-19 in Canada so far. And I just heard on the news not so long ago, I think it was 11 o'clock news for last night, that 101 Canadians have died from COVID-19 so far. So this is a flyer that I got from the government, delivered to my mailbox from the Government of Canada last night. So, help reduce the spread of COVID-19. So follow the advice of your local public health authority. Wash your hands often with soap and water for at least 20 seconds. Use alcohol-based hand sanitizer if soap and water are not available. Avoid non-essential travel outside Canada and consult travel health notices. Cough and sneeze into your sleeve and not your hands. Avoid close contact with people who are sick and practice social distancing. So social distancing means to stay at least 2 meters apart from other people, or if you prefer, 6 feet apart from other people. Try not to touch your eyes, nose, or mouth. Symptoms of COVID-19 may be very mild or more serious and may take up to 14 days to appear after exposure to the virus. So symptoms are fever, greater or equal to 38 degrees Celsius or 100 Fahrenheit. Cough. Difficulty breathing. And if you have symptoms or have recently traveled outside Canada, isolate at home to avoid spreading illness to others. Call ahead before you visit a healthcare professional or call your local public health authority. Avoid visits with older adults or those with medical conditions. They are at higher risk of developing serious illness. And if your symptoms get worse, contact your healthcare provider or public health authority right away and follow their instructions. And I think it goes without saying, if you have difficulty breathing, call 911. You need an ambulance to get to the hospital if you're having difficulty breathing. And I mean, the reason why I'm mentioning these is because I, like everyone else, I'm sick and tired of being on lockdown, only being able to go out for essential services and essential products, not being able to go to the shopping mall under regular circumstances, not being able to go about my regular life. And I'm sure lots of other people have cabin fever right now. and would like to get back to life as normal, be able to go out to restaurants again, go out to nightclubs, go out to movies, go out to public gatherings and that kind of thing. Well, we're not going to be able to do these kind of things if the number of COVID-19 cases keeps increasing, as it has in Canada and many other parts of the world on a daily basis. And the only way that we're going to be able to reduce the number of COVID-19 cases or reduce the increase in COVID-19 cases is by following the instructions of the medical professionals. Like this flyer that I'm holding on to right here, this is from the Public Health Agency of Canada. So those are medical professionals giving us this advice. The longer that COVID-19 cases keep rising, the longer that we're going to be under lockdown, and the more stringent measures that are going to be brought in. Like, I'm tired of being on lockdown. I know the majority of you are tired of being on lockdown too. I don't want to see more stringent measures brought in, and I'm sure you don't want to see more stringent measures brought in either. Just please follow the things that are on this flyer: the social distancing, washing your hands frequently, coughing and sneezing into your sleeve, not your hands, avoiding non-essential travel outside Canada. Well, avoiding non-essential travel outside your home, period. Okay? This is a team effort. We all need to do our part in order to reduce the number of COVID-19 cases and in order for life to get back to normal. It's going to take a while. If we do our part, we can get it back quicker. And another thing too to be aware of is that I've heard about cases of people coming in contact with other people that have COVID-19. They might not be aware that you might not be aware that you came in contact with someone with COVID-19, and you may even be asymptomatic. In other words, you might not have any symptoms of COVID-19 yourself, but you can take those. You can become a carrier for COVID-19, and as a carrier, you can end up unknowingly passing along COVID-19 to someone else, someone who's vulnerable, someone who's elderly. Like, just think about it. Do you really want to pass along COVID-19 to your parents or your grandparents or your great-grandparents or someone else whose immune system might not be so strong and might not do a very good job of fighting it? I don't think so. So let's just do our part and follow what the medical professionals are saying. I was hearing on the Canadian news last night that they believe that the peak of COVID-19 cases are going to peak in Canada in the next few days. So what that basically means is that that's going to be the highest number that they expect to see, and then going forward after the peak, that they believe there's going to be less and less new cases each and every day. So there is a light at the end of the tunnel. We just all need to work together to see that light at the end of the tunnel sooner rather than later. Let's all work together and bring this COVID-19 epidemic to an end. Okay? We all need to do this together. It may not be, like, this is a case of short-term gain for long-term pain. It may take a while, but we can all beat this together.